Cholera is a communicable disease that brings suffering to many people around the world. The cholera bacterium is usually found in water or food sources that have been contaminated by feces from a person infected with the disease. Cholera is a diarrheal illness because of an infection in the intestine with the bacterium Vibrio cholerae. Cholera is most likely to be found and spread in places with inadequate water sources, poor sanitation, and inadequate hygiene.
Ahmed Hussein became very malnourished and dehydrated, so he went to the doctors. The doctors realized that he was infected with cholera. The next day, his mother and 2 sisters were also diagnosed with the disease. They realized they contracted the disease because they drank from contaminated water. Hussein did not have access to clean water, so his only choice was to drink the dirty water. Like him, there are millions of people around the world who do not have access to safe water, so they have to drink the contaminated water, which leads them to contracting life-threatening bacterial diseases like cholera. Every year, 1.3 million to 4.0 million people are affected by the disease, and out of those people, 21,000 to 143,000 men, women, and children die. There are always new outbreaks occurring worldwide in countries such as Somalia and Yemen, and without the help of organizations, there will be many more deaths and cholera outbreaks than there already are.
When an individual first contracts cholera, many symptoms present themselves. Intaking water or food contaminated with cholera can lead someone to have symptoms like leg cramps, severe diarrhea, and vomiting. Cholera can also cause the body to rapidly lose fluids, which in turn leads to dehydration and shock. Dehydration can cause the body to be more susceptible to even more diseases, so it is best that cholera be targeted quickly. The progression of this diarrheal disease is linked to inadequate access to clean water and sanitation, as well as inadequate hydration. Many refugee camps in third world countries lack access to areas with safe water and bathrooms. These factors further grow the Vibrio cholerae bacteria, which is found in food or water which has been contaminated by feces with cholera. It generally takes between 12 hours and 5 days for any major symptoms to show. If these are ignored or left untreated, it can lead to death. Many refugees struggle with having the resources needed to stop or slow these symptoms, which severely affects their population as a whole.
Fortunately, the disease can be preventable and treatable through intervention. One way of preventing the contraction of the disease would be to develop the economy and the socioeconomic status of many people so they can afford clean water. Other ways include distributing safe drinking water, oral cholera vaccines, and adequate sanitation to third world countries that lack those things. Ways of treatment through intervention is distributing oral rehydration therapy packs, IV fluids, and antibiotics, and setting up treatment centers in rural areas.
There are health determinants that play a role in how this bacterial disease spreads, such as the socioeconomic status, overpopulation, and poor infrastructure in a community. Due to many individuals not having enough money, clean water is not affordable. Thus, they are forced to drink the unsanitary water that could contain the cholera bacterium. Due to overpopulation, especially in refugee camps, many people are forced to drink the same contaminated water, which in turn creates a cholera outbreak in the community. Because of poor infrastructure, the sewage system is outdated, resulting in infected people defecating in water sources.
The Eastern Mediterranean region is a special focus for intervention because this region has the most cholera outbreaks. These are third world countries such as Somalia and Yemen, where they do not have access to clean water.
Somalia, a country in the Eastern Mediterranean region, is one that faces cholera outbreaks every so often. One outbreak in particular occurred after a drought came over southern Somalia. The absence of water caused the crops and livestock to die out, causing Somalians to crowd into refugee camps, where the cholera bacterium is present. The lack of vital resources and the overpopulation in these camps increased the number of cholera cases in this region of Somalia.
There are many governmental and non-governmental organizations that are trying to help with the cholera crisis in many third world countries. UNICEF is playing a critical role in many countries such as Somalia. They are increasing access to cholera treatment and the oral cholera vaccination. They are providing medicines, medical supplies, and kits for the setup in treatment centers. They are developing staff and treatment areas as well. They are partnering with WASH to increase access to safe water, sanitation, and hygiene promotion. UNICEF is also providing latrines or toilets so the people would not defecate in water sources. In addition, the World Health Organization is also providing health workers for cholera surveillance, infection control and prevention, and going house to house for WASH campaigns. In Somalia, the Ministry of Energy and Water Sources is creating new regulations to tackle contamination.
In conclusion, organizations and health workers are working together to lower the number of cholera cases across the world. Of course, it will be difficult to dramatically drop the number of cases, but with the help of donations in many organizations around the world, it can be accomplished.
The biggest difficulty would be to gather resources such as money and medical supplies, but with the help of donations and organizations, it can be done. A good way to raise awareness in this issue would be to advertise it on billboards and in commercials. We can do it, and together we can lower the number of cases around the world.